Hi everyone, I'm demoing NG insertion. You're going to make sure you have all your supplies for this skill. You want your dual lumen stomach tube, your NG tube. You have your pen light to check for placement in the throat. You have your basin to put stomach contents in. This is my simulated lubricant. We're not going to use lubricant on these mannequins. You have your stethoscope to check for placement, your safety pin to secure it to the gown, your syringe to pull back the stomach tube or the stomach contents, and then make sure you have your suction tube if you don't already have it. We'll have it with our patients for our simulation. You have your tape. You want to make sure you have a piece all set up so that you can secure it to the nose when you check for your placement. You have your cup of water with a straw if your patient's able to tolerate it, and your pair of clean gloves. You're going to come in with all of your supplies. I'm Allison, your nurse. We're going to place an NG tube, which is a tube that's going to go through your nose, down your throat, and into your stomach. Let me check your name and date of birth. They'll let you know what their name and date of birth is. You check their wristband. You've got your 2 identifiers. You're going to wash your hands, pull your curtain for privacy, and grab a pair of clean gloves. This is not a sterile technique, but you do want to keep it as clean as possible. Your bed is going to be as high as it can go in that high Fowler's position. You're going to open your NG tubing to get your placement. You have notches on your tubing that are numbered. You're going to take your tubing from the tip of the nose to the earlobe, and then from the earlobe down to the xiphoid process, which is the tip of that sternum bone. Once you have that measurement, you're going to note what this measurement is. On this tubing, it's 52. So remember it, mark it down, or put a little piece of tape on there to help you remember. You're going to take the end of this NG tube and you're going to coil it around your finger. You want that bent because the hardest part of getting the NG tubing in is to get it past that nasopharynx. So while you're holding this coiled, you can ask your patient, hold one side of his nostril or her nostril. Can you breathe through this side okay? Hold the other side. Which side is most patent or most open? Because sometimes you can have, if they've had a broken nose, it can be more open on one side. After you know what nostril you're going to use your dominant hand to hold that tip, and you're going to keep the rest of it coiled in the other. It's clean, but you don't want this hitting a lot of surfaces to keep it clean as possible. Let your patient know, okay, we're going to insert this now. You get your water-soluble lubricant. Keep it bent if possible, and then you insert it down through the nasopharynx. They're going to cough. Sometimes it can bleed a little bit. Sometimes you'll get resistance, and you have to twist it that 180 to try to get it past that resistance. Once they're coughing and they can tell it's in their throat, you can take your pen light, make sure it's back there. It is going down his throat. At this point, you can give him his water. Tell him to drink with his straw whenever you ask him to swallow. And then you're going to tilt their head forward. You're going to have them put their chin down towards their chest to facilitate that tube going down. You're going to keep pushing. Go ahead and swallow. Swallow. So every time you push back, you want that patient to swallow. Now with this mannequin, it only goes to about 25, so you can't get it all the way down to that marking. But go ahead and say what number you would get it to. Now, once I have it to 52, I'm going to take my tape, put a little piece of tape underneath, just like we did when we did it with the IV. You put it underneath, then you cross it over top on their nose. Don't get their eye. And then cross it again on the other side. Because as soon as you let that go, if they cough or they are pushing, that can come right out, and then you have to start over again, and it's uncomfortable for them. So now we're going to check and see if it's in the right place. So you're going to take out the tip of your cover. You're going to take your syringe and pull back for stomach contents. Obviously this one isn't going to have anything in it, but whatever you get, you're going to put in your basin. You can have your strips that check stomach content for the pH. Check your strip. If it's the correct acidity, then you know you're in the right location. Another way to check, you put your stethoscope on, you're gonna get an air bolus in your syringe. You're gonna have your stethoscope put the placement of the stethoscope at the stomach level, and you're gonna push and push air in. That is no longer guaranteed that it's in the stomach, because if it's in the lungs, you can still possibly hear that air. So you are not able to put this to suction until it's verified by an x-ray. But for now, we're going to go ahead and you put another piece of tape around the bottom of this. You're gonna tape it. You're gonna put your safety pin through your tape so that this tubing is secure. Keep this piece of tape here also, so it's double secure. And then after you get that verification through x-ray, you're gonna hook it up to your suctioning, and then you're gonna put it on a mild suctioning. Make sure your patient is comfortable as they can be. You're going to change your gloves. If they need mouth care, you're gonna wash your hands, put on a new pair of gloves. You can set them back to a 30 degrees phallic position. Make sure they don't need anything else. You're gonna give them their call light, get all of your supplies gathered, cleaned up, open your curtain, and then wash your hands once you're done with your patient. And that's it for NG insertion.